chest syndrome is also called ACS. It's a sickle cell crisis in the lungs. Normally, blood travels through vessels to the lungs to pick up oxygen and then delivers the oxygen to the rest of the body. In ACS, blood is sickling in the lungs, so it can't pick up as much oxygen as usual. Signs include a fever over 101, chest pain, coughing, wheezing, and shortness of breath. Infections can cause ACS, and so can a pain crisis. If admitted to the hospital, it's important to make sure your child continues moving around even while experiencing pain. It's also important to continue breathing exercises with the incentive spirometer while in the hospital. Another possible cause of acute chest syndrome is having sedation for a medical procedure. Please let your medical team know about any upcoming surgeries or sedation. In many cases, we can give a blood transfusion before surgery to help decrease the risk of ACS. If you think your child is developing acute chest syndrome, go to the emergency department immediately. If your child is having trouble breathing, call 911 to get an ambulance to the nearest hospital. When you arrive at the hospital, tell the doctors that your child has sickle cell, and tell them if there is trouble breathing, chest pain, shortness of breath, or wheezing. If your child has fever and a chest x-ray shows that blood is sickling in the lungs, the doctors will diagnose ACS. Some children develop ACS while they're in the hospital for another sickle cell complication. If you feel that your child's breathing is worse while at the hospital, tell your doctor immediately. Your child will get IV antibiotics and most likely will receive a blood transfusion. Your child may also need oxygen to help breathe until the lungs heal completely. Acute chest syndrome may take several days to a week to get better. Be sure your child has received all recommended vaccines, including Pneumovax and a yearly flu vaccine. Also, the drug hydroxyurea decreases the risk of getting ACS. If your child has a severe episode of ACS, your doctors may want your child to receive blood transfusions for several months until the body heals.